delving into youth employability and the psychology, and where psychology, understanding the youth of today are not the youth that used to be. They have been raised in an environment of technology. This is an appreciation of oneself based on what other people think about them. So in the world of therapy, we call this an external locus evaluation. You think outside of oneself. And this has led to a huge lack of confidence in relation to use. By working in a completely different way, emotional awareness interwoven through this, it will automatically and organically increase the compounds, what we refer to as the inner locus of evaluation. It's incredibly important that the youth of today have an opportunity to grow and develop. This comes from being psychologically aware. And if we implement psychology from nursery through to school, through to university, the opportunities, their confidence, and the things to strive for in life that make them actually feel much better in themselves. So working from the in out, the sooner that happens, the better. And I'd like to see it happen today.
I think, minus the technical issue, so thank you very much for your patience, start to see how the framework that APRA is proposing by linking education, children's social care and employability, they all interlink. That is a lot more stable for the psychological and emotional well-being of everyone that's connected to those systems. But if we don't, and our crime reduction focus doesn't change, we are going to have a drain on resources as young people and individuals who are reacting to the situation with the pandemic to illegal means to survive. So the key three areas that APRA is proposing: psychological, transition, and post-incarceration. There's programs that are available through the Community Learning Hive in crime informed and all psychologically rooted. And they can be delivered at these three key phases. This is the first time across the whole justice experience, not just at the end or just before somebody leaves the system or 3 months after they've not reoffended. You cannot, in any stretch, create a change if we do not put that cycle. We've already touched on the transition from children's social care to justice. The UK, that's at 40%. And it's up as the number of people coming into the social care system increases. This is the same across the world. This is not a UK specific issue. We have to put crime reduction at the key of that psychological awareness. So
the research reflects that if you look to most prisoners to help them think about where they came from, most that their childhood came from a place of feeling completely trapped, completely terrified, and dominated in a very negative way. Exactly the same dynamic. Trapped, you don't know what the person next to you has committed as an act. Could be, it's incredibly dangerous, in which case the young is unable to escape and dominated as an adult due to the environment within a prison and within the prison system itself. By actually understanding in relation to the self-awareness, that person can develop in a way that actually helps them learn to live somewhere else. And I say that from a place of being, through your own self-awareness, you can change the outcome of where you are. But I guarantee you, if you spoke almost of prisoners in prison, you will find trauma in their background, and you will find a lack of education as to how they got there. By changing the whole night on that trauma wasn't their fault, but more importantly, how to come away from it and learn to think differently, react differently, absolutely extortionate on a country's well-being, a country's finances, and a country's opportunity to live in a much more peaceful way without.
The biggest challenge the whole sector of mental health has to face is the sector itself. Touched on this at the very beginning. we have to realign the focus into what people feel. What people mentioned earlier, when we understand and can label our emotional responses, we can open up a lot easier. One of the worst phrases I was ever exposed to growing up: what do you think you're doing? How does they don't think, they don't know what they're doing, they're children. How do they feel? When we understand that emotion, we can change the psychological responses. So 4 points of focus. Let's start talking about the emotional well-being of people that are struggling to respond to trauma. But we understand we are all responding to the experiences that are given to us. Let's ensure that there is a professional, ethical and well-being professionals. Let's hold ourselves to that standard across. Career pathways for therapeutic professionals have to be cemented in place. Professional can be qualified by going through university, yet every educational pathway before that point excludes. Just let Andres back in. We have to make sure that as we grow the awareness, that we are embracing the professional vocation of therapeutic engagement. And let's ensure that every government interaction with the public comes from a place. Every single human being is trauma aware. They just need the support to be able to impact on how they face the world around them. This is not a them and us about service delivery from or government authorities, because ultimately those services are delivered by other people. But the system of understanding that psychological awareness is going to be the critical component that avoids becoming the most costly part of this pandemic. And again, there she is. I knew she was there somewhere. She's got to say this stuff.
Being a much better label than the mental health label. Mental is an old English word signifying madness. This is in relation to going and getting help for themselves. We also believe at APA that every single professional involved in relation to self-awareness in particular. So we believe in academic training, but we also absolutely rate therapy as being an essential pathway to all therapists practicing. We also believe that a more effective way of being. The emotional well-being of the individual is based on their whole being. For them, our body's over here, when actually we're a whole person. We're one being. We don't have mental health. By therapists, counsellors, psychologists, by everybody in the mental health field, in particular, certain topics need to be explored more. For example, eating disorders. Any psychologists, but actually we're not often educated about things within that. We're educated as to how to, educated as difficulties themselves. It's that eating disorders are not a disorder, and I'm using this example in particular because food is not the issue. The reason why and the more therapists, the more counsellors, the more in the world of mental health, more importantly, emotional well-being, work in a more efficient way for clients in front of them. And ultimately, the courage of the client going to therapy is mad. If anything, it makes them competent, self-aware, and courageous to actually bare their heart and soul and put that into somebody else's hands. Well, those hands need to be solid hands. You need to be able to work with that person as a team. There is no I or them in my book. There is working together to create a change for those individuals. and not just academia that actually creates the best counsellor out there. There are studies after studies that soul to soul with a client in front of them is actually as reflective of their personality as well as their academic training. Hence the organisation out there. You don't just like to see the academic qualifications, it's essential for our assessment with another human being, because that's actually what therapy is. People talk about the label of therapy. It's actually the relationship between the therapist and the world of mental health needs to change. And that starts with replacing the word mental, removing the stigma and allowing the courage of those clients. The more we practice this and the more we're aware of this, the more the systems will change overall. And that for everybody across the whole world will be of benefit. Therapists, not just counsellors, not just psychologists, but most importantly, to the people that are looking for help. And considering the crisis we are heading towards, it's absolutely as safe as they possibly can.
So, they're the key areas that APA's framework have been built around. The framework, as of Monday morning, countries, national organisations and those local organisations that want to build a platform. These licenses come with focused support, training and policy guidance packages available. We are offering consultancy access to qualified, accredited therapeutic professionals from within our communities with dedicated individuals to provide that support, to provide that question and answer in building policy. Through the Peaceful Mind Foundation, we are bringing a global connectivity that has never been, because when world leaders using these frameworks are together on the global stage, consistent and unified way, the message of mental health changes in an instant. The conversation increases, is ultimately grown. And that increases psychological awareness across the world very, very quickly. So I asked two questions. And I hope this framework gives you as practitioners the impetus, the motivation, the ability and the tools to be able to, and that you can now see that in this year, there is truly a chance to grow, to make it. Those two questions are for you and for you to answer for yourselves, not for me to put to you.